All right, well, we'll go ahead and get started this afternoon. Good day and welcome to today's webinar, the COVID-19 Continuum, Mental Health and General Medical Considerations, presented by the Athletics Healthcare Administrator Association. Closed captioning for the webinar can be enabled by selecting live transcript and then show subtitles. My name is Dr. Jim Borchers. I'm the President and CEO of the U.S. Council for Athletes' Health, the umbrella organization for the AHAA. Our panel of sports medicine and mental health experts are prepared to address the current challenges and management strategies for COVID-19, mental health, and general medical considerations. We'll also look at post-COVID and long COVID mental health implications on clinicians and the mental health management strategies for student athletes. Before I introduce our moderator and our esteemed panelists today, I need to review just a few housekeeping items with you. Your camera and microphone will not be available today during the presentation. However, we encourage you to use the Q&A function to submit questions for our panelists. A transcript will be made available following the event. For athletic trainers looking to obtain CEU, a certificate will be sent via email from info@USCAH.com after the webinar today. An email will also be sent to all attendees with a course evaluation survey. As always, we appreciate feedback from all participants, and it should be completed to claim the continuing education credits for athletic trainers. Now I'm honored to introduce you to our panelists for our discussion today. Abigail Eiler is an Assistant Athletic Director for Student Health and Welfare at the University of Michigan, as well as the Director of Athletic Counseling, the department's Chief DEI Officer, and the current chair of the Big Ten Mental Health and Wellness Cabinet. As a licensed clinical social worker and educator, she serves as a clinical assistant professor at the University of Michigan's School of Social Work, where Abigail has supported over $8 million in research efforts with an emphasis on improving mental health screening and services for youth and young adults. Our second panelist today is Robin Shofield. She is the Director of Culture and Wellbeing in Clinical and Sports Psychological Services at the University of Southern California. She oversees individual services for student athletes as well as services related to team culture, cohesion, leadership, and performance enhancement. She also serves as the co-executive director of the Science Institute and a professor in the Department of Psychiatry and Behavioral Sciences in the medical school at USC. And our third panelist today is Robbie Sika. He is the founder and chair of the COVID Sports and Society Work Group that brought together leaders in professional sports, government, entertainment, and technology to revolutionize accessible COVID testing. Dr. Sika also works with the Denver Broncos to serve as the Vice President of Basketball Performance and Technology for the Minnesota Timberwolves and in consultant roles with the Minnesota Vikings, the Washington Wizards, and the NBA Sports Science Committee. And our moderator today will be Dr. Chad Asplund. Dr. Asplund, who's known to many of you that have joined our webinars before, is a sports medicine physician and professor of family medicine and orthopedics at the Medical College of Georgia in Augusta, Georgia, and serves as a senior associate for the U.S. Council for Athletes' Health. He's also the past president of the American Medical Society for Sports Medicine. He currently serves as the medical director for USA Basketball and a team physician for USA Hockey, USA Triathlon, and Georgia Southern University. As I mentioned, my name's Jim Borchers, and on behalf of USCAH, I hope you did enjoy today's discussion on the COVID-19 continuum. Chad, I'll turn it over to you.
Thanks so much, Jim, and thanks for our participants and especially to our panel. We really have some of the leading experts in the country, if not the world, on the mental health and the medical aspects of the coronavirus. Certainly, lots of us would have hoped or thought that we would be behind COVID by now, but it is still here, and the effects of COVID are still affecting our athletes and people in the public. Dr. Shofield, COVID has had a lot of mental health implications that we've seen in a lot of athletes as well as regular people. What sort of fallout have you seen in mental health or changes in acuity or presentation have you seen since the start of the pandemic?
So I think there's, a lot of different pieces to this, but I think one of the biggest sort of fallouts that we've seen is that folks who had any pre-existing mental health issues, whether it's anxiety, it could be low-level anxiety, depression, family relationship difficulties, other situational difficulties, So sort of that contingent that came in with things that made them a little bit vulnerable. And then, the other contingent is a very common group in the elite athlete population, which is folks who are just a little bit more tightly wound. They're often the student athlete that the coach loves, the academic people love, because they do everything that they're told to do exactly the way they're told to do it. And those two groups, I think, really struggled with COVID, especially as time went on. I mean, I know here at USC, we tracked our athletes very carefully. And despite our spring sports losing their seasons and our Olympians having the Olympics pushed a year, and the initial sadness and loss over that, the athletes did pretty well for the first 5 months. And we actually did a survey in September, and well-being was still pretty good, but resiliency fatigue was starting to set in. We had done some resiliency work in May. Nonetheless, by beginning of September, it set in. And Zoom fatigue had set in, and we were not back. Our student athletes were not back. Few were, but not until January. So those didn't bode well. And then we saw, as that semester continued online exclusively, and our student athletes for the most part weren't back, we saw the fallout of that by around Thanksgiving, at a time where usually you're getting some relief because school's winding up. So the net effect was really higher acuity overall. So we had a lot more folks that needed to be referred to a higher level of care, intensive outpatient, some hospitalization. We had a dramatic increase we saw starting in January of eating disorder issues, particularly amongst women who either didn't want to eat because they weren't exercising or struggled with that adjustment when the level of exercise was reduced. So those two issues are significant in that the level of more critical cases we had was about 3 times the level in that 3-month period that we would see usually annually. So I think those were some of the main fallouts.
That's pretty significant because I know that this generation of college students and young people already has a higher level of baseline anxiety than those maybe 10 or 20 years ago. And so bringing that to the university and then sort of increasing the numbers that are now presenting in crisis as opposed to early on can certainly overwhelm a system or can certainly create a problem. Dr. Sika, there can be a lot of sort of interaction between mental and physical health side effects from COVID. What have you kind of seen in your clinical practice, or what are the clinical implications that you've seen?
Well, I think it's a great question because we know that as Robin alluded to, there's a lot of tie-ins between the mental and physical aspects here. One of the key things is to separate this into 2 populations because there's a social construct to COVID that probably hasn't been dealt with since HIV. It's a disease that almost points a finger in a lot of ways. You exposed me, you cost me this, oh, you did get the vaccine, you didn't get the vaccine. So there's a population that doesn't have COVID but has a mental health issue. And then there's the population of people who have COVID who have some sort of manifestation or the potential elements of long COVID. So it's understanding that everyone is impacted on the mental health side right now. And we have to recognize the social construct of the disease. Now, I've been affiliated and seen on the pro sports side where we have access to athletes and we have access to testing. And so we're able to understand our athletes at their baseline, probably better than an average patient who's walking into a clinic. And what we have to remember is there's the performance side and then there's the health side. I think there's a mental health component to performance that COVID can impact, just the subjective, hey, I don't feel right, I can't come back. And then what's really clinically relevant. So it's understanding these athletes and explaining to them that this is not a flu. This is a different virus. It's why you don't want to get it. It's why you should get vaccinated. Nothing's perfect. You practice so you can win a game. Just because you practice doesn't mean you're going to win a game. Just because you get a vaccine doesn't mean you are not potentially exposed. So it's empowering people with information because we live in an age now where this is your data, this is your health, this is your life, and it's educating people and giving them a chance to take ownership of that information, of that data. Now, from the true physical manifestations of mental health, I've had coaches who couldn't remember stuff for 3 months. They truly struggled with play calls and memory and where their keys were. And I've had people who were, they really struggled with, I just can't open up my lungs. And there was nothing on the actual PFTs, but there's something there. And the hard part for us as a society is we don't really have a good diagnostic test for long COVID. So separating it out right now, it becomes a phenomenon where we don't know what long COVID is. And I think if the people who are listening in on this call can do anything, it's understand that long COVID is real. There are vascular and neurologic manifestations of this virus that the biobank study, I would encourage all of you to read that study from England. It's one of the best studies that's ever been done that looked at memory implications, actual loss of gray matter and brain tissue, and how profound it was. And when you recognize that, you will find that when you talk to someone who had COVID, ask questions, find out where they were at their baseline, use other data to understand where they were and where they are today.